BHA for Equality is a health and social care charity. We work primarily in Leeds, Manchester and Wakefield with black and other minority ethnic groups, but we also work with LGBTQ+ communities and other areas of equality. We began working within HIV, but we then started moving into other healthcare areas where we recognised that minoritized groups were not being reached by public health messaging. Manchester is one of the 3 highest areas of TB prevalence in the country. For example, the Pakistani community, around 29% prevalence, and that's why we have programmes specifically targeted to reach them.
TB is an airborne bacteria which you breathe in, and it can live in your body for decades and wake up when your immunity is low. So we inform people to get screened before it makes them really ill.
During the pandemic, we recognised quite quickly that there would be a confusion around TB and COVID because the symptoms are quite similar, because people would have been advised not to go to their GP if they had COVID symptoms. And our commissioners were able to support our work to ensure that TB remained high profile.
I know that I can trust BHA and their staff to liaise with a whole multitude of stakeholders. They're really good at developing those relationships. It's really helpful in us understanding our communities much better.
During the pandemic, we recognised quite quickly that people would fall behind on their screening uptake. We started putting leaflets within actual food parcels at food banks, 7,000 of which were distributed in culturally appropriate languages to encourage them to maintain relationships with their screening clinics.
I was diagnosed with prostate cancer in 2014. I found it very early, so I was very lucky. Other cancer organisations don't give me advice, but I said, I want to speak to somebody who's been where I've been. BHA have come along and I've met black professionals. I'm thinking, wow, I can talk to you proper. It's small things like that makes people open up.
The Anti-Cancer Service is a partnership delivering community services to not just ethnic minority groups in this case, but people with disabilities and other groups as well. We had the booby bus that we would take to public places like supermarket car parks.
We actually went to different stores and we gave flowers to women, just to let them know that they're special and they need to go to screening on time.
The PASH project, Passionate About Sexual Health, is a partnership covering sexual health across the whole of Greater Manchester. Even during the pandemic, we were able to reach around 7,500 people through a mixture of online and face-to-face means. The Leeds Skyline project is actually a group of projects working with ethnic minorities and LGBTQ+ communities affected by HIV and other sexual health conditions. An example of that would be our Positive Peers programme, peer mentors who had supported and trained to raise awareness within their own communities of positive sexual health.
No one wants to, share their HIV diagnosis because there's still stigma attached to it. It's easier for you to share with someone your age who has the same sexuality. It makes you feel comfortable. It helps with your mental health as well.
In Leeds, we've done quite a lot of work in terms of promoting PrEP. So these are drugs that can be used to prevent the transmission of HIV even across people who are positive.
The great news is that with HIV, we know we can end new transmissions, but how do you get people tested so they know they have HIV? We can't really make an impact without BHA. They have that connection with the community to help facilitate that discussion.
People have said, this feels like home. I walk into this room, I feel welcome. That's what BHA stands for.